killing drug dealers won't protect children from the opioid crisis. They need safe homes. President Trump's proposal to solve the opioid crisis by executing drug dealers is reminiscent of the failed war on drugs, and it's an absurd solution to a public health crisis that ravages families, children and entire communities across the nation. Children are entering foster care because their parents are addicted to opioids, and the epidemic is only getting worse. This crisis demands a response focused on treatment and prevention, so we can keep these families together and protect our most valuable resource, our children. Between 2012 and 2016, the number of children in foster care increased by more than 10%, bringing the total to nearly 500,000. This upsurge disrupted a decade-long downward trend. Strikingly, in the past 8 years, the number of child removals in which substance abuse is a factor has nearly quadrupled, particularly in regions with higher levels of opioid prescribing and opioid deaths. In these same regions where the opioid epidemic is most prominent, our youngest children are hit especially hard. Many suffer as a result of their parents' addiction. In 2016 alone, 676,000 children were victims of abuse and neglect, and approximately 29% of maltreatment victims are younger than 3. More sessions. Trump say tough it out without opioids, but they never felt my pain more. What it will take to fight the opioid epidemic, sends. Roy Blunt and Shelley Capito. But state child welfare agencies are struggling to keep up. As these children enter foster care, budgets are stretched, caseworkers are overloaded, and safe homes that can meet kids' needs are limited. This lack of resources endangers the children who are most vulnerable, and in too many cases, children are harmed in the very system meant to protect them. States must do more to prevent child abuse in families and out-of-home care. Leaders and policymakers must reform our overburdened foster care systems to protect children suffering the cruel consequences of the opioid crisis, because for our kids, families and communities, the consequences of inaction are too great. Child maltreatment, whether in a child's home or in foster care, inflicts long-term consequences on well-being and development. Research shows that abuse and neglect can delay and even prevent healthy brain development, including cognitive thinking and language abilities. Survivors of abuse are at a heightened risk of developing poor mental and emotional health and falling into alcohol and drug abuse. That's why we must act quickly to ensure foster care systems protect our children and not perpetuate the cycle of abuse. More, where is Trump's emergency on opioids? Policing the USA, a look at race, justice, media to protect our most vulnerable children. Children's Rights has worked to reform some of the most egregious foster care systems. We represent children like LT, a remarkably strong and resilient 16-year-old in Florida who has been moved 25 times in 4 years and was sexually assaulted while in the state's care. And children like Hesse, who entered Texas foster care at the age of 5. Within 4 months of entering care, she reported being sexually abused by an older child, and the agency did not interview her or provide her with a medical exam or treatment. When she aged out of care 13 years later, she had been shuffled among 28 caseworkers and 33 placements throughout the state, including foster homes, residential treatment centers and shelters. Children like LT and SA needed safe, loving homes and the opportunity for a permanent family, and now we're in the epicenter of an opioid epidemic, leaving even more children in need than ever. Congress has taken essential first steps toward preventing the need for children to enter foster care in the first place by passing the Family First Prevention Services Act, which provides money for preventive services such as in-home training, family therapy and substance abuse programs. In March, partly in response to the opioid crisis, Congress raised the funding level for Child Abuse Prevention and Treatment Act state grants from $25 million to $85 million. The money will help states protect infants exposed to controlled substances. But this is only a start. We must continue to invest in evidence-based drug treatment, mental health and counseling programs that help keep families together. And for those kids who must depend on the state to meet their most basic needs for care, We have to re-engineer foster care systems so that they actually provide the therapeutic support and the stability young people need. Our nation is in a crisis, one that demands real, thoughtful solutions. Until then, our children should not have to pay the cost. We can and must do better. Sandy Santana is Executive Director of Children's Rights.